Firstly, let us learn the names of the muscles that are present in the anterior compartment of the arm. They are the coracobrachialis, the biceps brachii, and the brachialis. The coracobrachialis muscle originates from the medial aspect of the tip of coracoid process of the scapula along with short head of biceps brachii and inserts into the middle of the medial border of the shaft of humerus. The coracobrachialis muscle is supplied by the musculocutaneous nerve. Now, what action does it help in? It is a weak flexor and adductor of the arm. In other words, it helps in flexing the arm at the shoulder joint. Now, the second muscle is biceps brachii. The biceps brachii muscle arises from the scapula and has two heads, the long and the short head. The long head arises from the supraglenoid tubercle within the capsule of shoulder joint and from the glenoid labrum. The tendon is intracapsular, which runs above the head of humerus and emerges from the joint through the intertubercular sulcus. Short head arises along with the coracobrachialis from the lateral aspect of the tip of coracoid process. The two heads join together in the distal third of the arm to form a belly that ends in a tendon which gives off the bicipital aponeurosis. Aponeurosis is nothing but connective tissue that connects muscles to bones like tendons. The tendon and aponeurosis of biceps have different insertions though. The tendon inserts onto the posterior part of the radial tuberosity, whereas the bicipital aponeurosis attaches to the deep fascia on the medial aspect of forearm, which is also an important landmark for skin incision in forearm procedures. Both heads of biceps are supplied by the musculocutaneous nerve. Now, coming to the action of biceps, the biceps is a strong supinator of the forearm when the elbow is flexed. This action is used in screwing movements such as tightening the screw with a screwdriver. The short head of biceps is a flexor of the arm, while the long head is a strong flexor of the forearm when the elbow is extended. The long head also prevents upward displacement of the head of humerus, giving it stability and preventing dislocations. The third muscle is the brachialis. It originates from the front of lower part of humerus, including both the anteromedial and anterolateral surfaces and the anterior border. Superiorly, the origin embraces the insertion of deltoid muscle, and the brachialis inserts into the anterior surface of the coronoid process of ulna. Now, coming to the nerve supply, brachialis is a composite muscle, which means it has dual nerve supply or two nerves innervating it. The musculocutaneous nerve supplies the median 2/3, whereas the radial nerve supplies the lateral 1/3 of the muscle. The principal function of brachialis is flexion of forearm at the elbow joint. This muscle is called as the workhorse of the elbow joint, as it is the untiring strong flexor of the elbow joint. Lastly, we are going to learn the names of the muscles that are present in the posterior compartment of the arm. The muscle that is present in the posterior part of the arm is the triceps brachii. Triceps brachii is a large muscle which covers most of the posterior aspect of the arm. As the name suggests, it has three heads. The long head arises from the infraglenoid tubercle of the scapula, and it is the longest of the three heads. The lateral head arises from an oblique ridge on the upper part of the posterior surface of the humerus, corresponding to the lateral lip of the spiral or the radial groove. The medial head arises from a large triangular area on the posterior surface of the humerus below the radial groove and also from the medial and lateral intermuscular septa. The triceps common tendon inserts into the posterior part of the superior surface of the olecranon process of ulna. However, to be more elaborate, the lateral and long head converges and fuse to form a superficial flattened tendon which covers the medial head and are inserted into the posterior part of the superior surface of the olecranon process. The medial head is inserted partly into the superficial tendon and partly into the olecranon process. The nerve supply to triceps is by the radial nerve. Each head receives a separate branch from the radial nerve. In axilla, the nerve to long head arises from the radial nerve, and in the radial groove, the nerve to the lateral and medial head arises from the radial nerve. Triceps is the sole powerful extensor of the elbow joint. So, if in the radial or spiral groove there is a fracture or penetrating injury causing laceration of the radial nerve, once the fracture heals, will elbow extension be completely lost or present? The answer is weak extension of elbow will still be possible, as the nerve supply to long head of triceps that comes from the axilla is not affected. Whereas if the injury is at the axilla, elbow extension won't be possible at all.